Welcome back everyone, I'm Dr. Jared Boasen. We're going to continue the video tutorial series with the Electrode gel application. Now with an EEG system like this, the electrodes themselves are not actually making direct contact with the scalp. And that means that unless we apply some sort of bridge between the scalp and the electrode, we're never going to be able to measure the brain activity. So to do that, most systems today will use an electrolyte gel. This is a very viscous gel. It's usually applied by sucking the gel up into syringes like this. You can see we have a couple already prepared. And at the end of the syringe will be put some sort of blunt needle. Now the word needle makes it sound scary. It's not scary. It doesn't hurt. Anne has tested it. Does it hurt, Anne?
Not at all.
It doesn't hurt. So the needle is just simply to help you get through the hair and to apply the gel to a precise location on the scalp. We don't need to bathe the participant's head completely in gel. In fact, we don't want to do that because then we'll get a phenomenon known as crosstalk. And that crosstalk is where the signal measured at one electrode site is actually the signal that should be measured at another one. And you're measuring the two of them together because you have so much gel that is causing a bridge to send that electrical potential up to a neighboring electrode. So we don't want to apply too much gel, just enough so that there's a bridge between the electrode and directly under it to the scalp. So to begin this procedure in Brain Vision Recorder, we have a special menu for doing impedance, and Xavier is going to select it right now. Thank you, Xavier. The Brain Vision system is very nice. It has an easy to comprehend visualization of the electrode montage with all of the positions in their anatomical placement. And you can see right now that all of the electrodes, they're represented by these red circles. The color is an indicator of the level of impedance of the electrode. Now, the standard for most EEG recordings these days is to try to get your impedance below 10 kiloohms. And Xavier is now adjusting that threshold there for us in the settings, and he's applying that. So this is the goal. We want to make sure that every electrode can get below this. By setting that in the software, now the color of the electrode that you see displayed on the screen will change according to how close we get to that threshold. And once we get below 10 kiloohms, we should have the electrodes change to a green color instead. Now, it is acceptable for us to record even above 10 kiloohms. It's not the greatest. For sure, we don't want to go anywhere above 50, or what does it say? The bad level is set at 60 here. So that's obviously terrible. We're going to have a hard time seeing actually what's happening in the brain. Most of our signal is going to be random noise, and we'll have a difficult time taking that out in the post-processing. So we'll do our best to get below 10 kiloohms here. Some important points to know as you do this and do any kind of EEG experimentation. The state of the participant's scalp is going to influence greatly your success at getting below this threshold. If a participant has recently washed their hair with shampoo and conditioner that have perfumes or that leave residues on their scalp, it's going to make it difficult to get below this threshold because those residues will block the conductance of electricity and essentially increase the resistance or increase the impedance. The other thing to keep in mind is if people have dyed their hair. Now, normally in recruitment, we have some recommendations about hair dyeing. We typically try to have a conservative threshold of around 1 month for hair dyeing, although you can go as low as 2 weeks. It depends on the hair dye though. However, it's difficult to determine with participants what dye they've used. So we just say, have you dyed your hair within a month? Yes or no, and then we'll decide to proceed with them or not. The reason why dye is important is similar to shampoo and conditioner, because it can leave residues that stay on the scalp for a long time, and those will elevate the impedance. All right, so we're going to begin by applying the gel. And to start, we need to begin with the ground and reference electrodes. So the ground electrode is here at the very front in the midline, and the reference you can't see, but it's a couple of electrodes back along the midline. I'm going to begin with the ground. Now there's hair in the way, so we're going to use this needle to sort of make a swirling motion and push the hair out of the way as we gently apply the gel down inside and make a bead of gel that goes from the scalp up to the electrode itself. So we'll give that a shot. First, I'm just going to swirl around, and Anne's going to let me know if I swirl too hard or cause any pain. A little bit of scratching on the scalp is actually a good thing and will lower the impedance. And depending on the age of the syringe, it could be more or less easy to depress the plunger. We'll continue to swirl this about. I'm going to tug a little bit. Oh, sorry. Did it hurt?
No. Okay.
All right, so as I apply the gel here, I wanted to mention that there's actually what we call an old school way of gelling up electrodes and getting the impedance correct. And that is to actually look at the raw signal while you're doing it. And most recording softwares, actually, this is all you can rely upon because they don't have a live feedback of the impedance. So we're going to go ahead and transition to the raw signal right now. And you can see there's already a change here because I have applied gel to the ground and the reference. You can see as I move the electrodes around a little bit, we can get some zigging and zagging of the signals. They're a lot flatter than they were before, and that's normal. And we have a couple of noisy channels, but we'll see what happens as we actually get them gelled up. Xavier, do you think you could increase the amplitude for us? So right now the signals appear flat, but they're not really flat. It's just that exactly the amount of noise in the signals has decreased because we have gel in the ground and reference. Keep going a little bit more. A little bit more, please. Maybe 2 more. Actually, that's pretty good, right? Yeah, that's good. That's good. Great. So now we're going to continue with gelling the electrodes, and we'll start with the other channels, and we'll see how the signal changes as we do that. And I'm going to call in Xavier, so this process will go a lot faster, and hopefully you guys will be watching it in a sped up way on the video. Okay. Let's get you down. Does it feel weird? I think it probably feels cool. probably could have gone one cap smaller, but it's like so close to perfect.
Mm-hmm.
It's always hard to choose the right cap. They make these caps with 2 centimeters of difference between each one. Probably because it's cheaper for them to manufacture. But what it means is that you have many participants that are not quite perfect. Here, I don't think I'm going to be able to get this one. It's too far away.
Yeah, behind it here.
Yeah.
Yeah.
This is often the case. And you'll learn this when you do it yourself as an RA. This one right here often doesn't fit very well. And that's all right, we can just exclude it in the analysis. You can see that the amplitude is increasing. This is good news because we're actually picking up the signal from the brain now. We have conductance between the scalp and the electrode. So now we need to readjust. And we don't quite have all the electrodes done.
Okay, it's pretty decent. Just wait for the signal to come down.
What is that?
This is
P8?
which is up to my side. I was behind 0.7, so it's this one.
So I mentioned earlier that we use a montage, and that montages are always used when you're using a cap layout like this. And our lab keeps its montage in a printed out state, and it should be in every experiment suite next to the EEG equipment. So it'll be on a paper like this. We're using the 32 channel standard cap for ActiCap. This title of this montage is actually very important. And when you write up your study in the method section, you will put the name of that montage. It's a standard name that will reference that back for any readers of your publication. And you can see on here, if I hold it up very close, maybe, and you'll see if you come to the lab, it has the layout of all of 32 of the electrodes with their number and their anatomical name. And this should correspond exactly to what's in your workspace on the EEG recording software.